Good morning, guys. I hope we're all sparkly. C-dip done. I've just had a sauna for toasty. And I'm just about to run the dogs. As you can see, Dex's silhouette in the back. But I thought I'd do a quick video, a follow-up video about what? Yeah, no prizes for guessing. Earn your reward through testosterone replacement therapy, the cure for life. No, it's not, is it? So listen, when you've got low testosterone, if you read the textbooks and you look to the adverts, they say low mood, anxiety, depersonalization, low libido, brain fog. Jump on TRT and you'll be suddenly cured. But you must address the things that we've spoken about many times before. What really is it? So low testosterone. I love this Friedrich Nietzsche quote. If you gaze for long enough into the abyss will gaze back at you. So what is it about? Yeah, we've said it many times before. It's about the journey. It's about movement. Movement is life. Earning your reward. Understanding that the reward is an illusion and actually the effort is the reward. So life can seem pretty unfair at times. If you expect life to be fair, then you are naive. You are incredibly naive. It is tough. And it's how you face these challenges. And you want to see them as opportunities, not threats. But with low testosterone, that's pretty difficult. So you jump on testosterone replacement therapy and hey presto, you're cured. No, unfortunately not. You still need to put effort in to be the best version of yourself and see that glass as half full. Because you can't always dictate what's going to happen in life. Unexpected things do happen. And it's how you react is the key to whether you see it as a challenge and opportunity or you see it as a threat. Because when you've got low testosterone, you see it as a threat. So with normal testosterone, it's still your conscious decision to see it as an opportunity. Now we are primed to survive. So we have the same neurotransmitters and hormones that we had back in hunter-gatherer days and the same instincts. And as you guys know, I love my dogs. And my dogs are more instinctual. They are sentient beings, 100%. My dogs know my mood before I know it. Incredibly perceptive. Dexter will come and sit on my lap if I'm angry. Maddie will leave the room. The wrath is about to erupt. No, never. Because I'm considered always. I want to react sometimes. I want to lose it. Because life is pretty unfair. But testosterone, as we said many times before, is the calming hormone. It isn't this roid rage kind of, I'm going to be a crazy alpha male hormone. Yeah, sure, you should be the leader, but you should be leading by example. You can't be the boss of everything. If you've got a missus, you know exactly what I'm talking about. So you have to be in charge of what? You. Yeah, you. Nobody else. And you need to lead by example because you set an example from your actions more than your words. So what is it about? Movement. Movement is life. When you're physically active, you are psychologically in a better place because you're releasing myokines that feed the brain, the positive reinforcement. And you know that you are rewarded for your efforts. But taking that step to be active is difficult because paradoxically, you're trying to protect yourself. So again, survival, survival, survival. Weirdly, your brain doesn't want you to go out, but you actually do need to go out. So it's your consciousness preventing you from going out. All these bad, negative learned behaviors that have got you into this position in the first place. So as we said many times before, we live in a perverse, overstimulated, oversaturated world full of utter nonsense. What's really important is right now, this very moment. The past is the past. You've learned from the past, and hopefully you're making your present more mindful to allow your future to be more productive. But still, life is going to throw you curveballs. So you have to be considered because karma is not getting what you want or deserve. It's getting what you get and dealing with it. That is the key to understanding what you should be doing as a human being. Because wouldn't it be lovely If everything was perfect, no, it wouldn't. It would be utterly boring if everything was perfect. If nothing ever went wrong, nothing would ever go right, because it's about contrast, yin yang. Out of darkness comes light, so move towards the light. Again, Carl Jung, shadow, massive advocate of Carl Jung. And again, we learn from all sorts of people, but we never take anybody's word as gospel, because we're all human beings and we're all flawed and we're all trying to work this stuff out. And that's the wonderful adventure of life, isn't it? We're all trying to work this out. But without that hormone base, because again, hormones provide that chronicity, your autonomic nervous system that's fight-flighting, again, looking for danger, looking for threat, is acute, and you've got a reactive brain. So without that base, you stand no chance. So you don't want to run low, you don't want to run high, you want to run balanced, baby. And microdosing TRT is the most effective way of achieving stable male androgen levels for long-term physical and psychological well-being. And ultimately, then the rest is up to you. So again, we talk about testosterone and the dopamine effect. And again, reward, which is why we're reward driven, why we're active. Again, go forwards, go prosper. Don't sit there. The most depressed people are the people who are doing nothing, and they're staring into the abyss, and the abyss is staring back at them. You need to be physically active. Again, my God, exercise should be on prescription, not antidepressants. Antidepressants, as we said before, raise your serotonin, the happiness chemical. So logically, that makes sense. But it's illogical to think that you would have high serotonin levels all the time and not have the ability to perceive joy and sorrow and work out which one you want to strive towards. And obviously, it's going to be joy. Hopefully, my God, hopefully. So yeah, we don't want a constant, we want to be normal, because it's about the subjective appreciation of change. So how you react right now dictates your present and determines your future. So you have to go forwards and be the best version of yourself. So normal hormone levels, anything in excess is bad for you. The clue is in the word excess. Super physiological, above your normal physiology. There's a cohort of numpties out there saying that it doesn't react in the same way and you should all be high because I feel great. Listen, get off the internet. Get on testosterone replacement therapy. Place your trust in somebody that knows what they're doing. Get what you need and then get on with life. Stop looking for shortcuts. We all look for shortcuts. Again, it's a survival thing, because obviously let's get to that destination quickly. But no, the destination's irrelevant. It's the journey. What's it about? The journey. So yeah, testosterone allows you to be calm and considered in your reaction to what's going on right now. Life is unfair. Get that in your head. But you can find joy and happiness and peace through movement and understanding that we're all one consciousness, experience itself subjectively. Love a bit of Bill Hicks. Wow. Okay. So yeah, healthy hormone levels are the key, but ultimately it's still down to you. And if it wasn't down to you, it wouldn't be worthwhile, would it? So again, you are in charge of your reactions and your actions, not necessarily what's going to happen to you. So get on with it and do what? Yeah, you know, go earn your reward.